Today we're going to talk about healthcare's main pain points, right? And this is something that I've been talking about religiously now for years. One of the biggest pain points in the healthcare industry is dishonest agents. First and foremost, I think it's the biggest problem that exists in our industry is dishonest agents. We actually have a YouTube series called Lion Ass Agents where we'll shop agents and we'll let them pitch us their products. They're selling garbage as if it's major medical. They know that the service piece to their business doesn't exist. They're never going to service their customers. And ultimately, what that leads to is a bunch of denied and unpaid claims. But we must have recorded a dozen of them at this point. And, you can only be fed so much bullshit, right? It's the same lies over and over again. This is a nationwide PPO. You're covered 80/20. When at the end of the day, it's literally just a PPO discount. It's garbage. One of the solutions to that problem is working with MediShield, expert healthcare brokers that understand that it's not a one size fits all when it comes to your health insurance. You literally have to be placed in the right product for your specific situation. So MediShield is where we can do that. Second pain point in the healthcare industry, medical billing. The entire practice of medical billing is an absolute mess. First of all, there's a lack of transparency, right? A lot of times if you call a provider and you ask them what their price is for their service, they give you the runaround. They say, it depends on what insurance you have and bullshit. The price is the price, and that's the way it should be, right? So there's a lack of transparency out there, and anytime you get that runaround, you're dealing with somebody that plays the game. You're dealing with a doctor that plays the game. They're going to bill you. If you can pay them cash right over the counter, they're going to give you the best price because it eliminates them paying the third-party billing. It eliminates them paying the administrator, submitting their claim to the insurer, waiting for their money to come back. They get their cash on the spot, right? And they like that, right? Where if they have to go through all those steps, you bet their ass they're going to send Blue Cross Blue Shield or whoever a bill for thousands more than what they're going to charge you on the spot, right? So they play the game, all right? So there's a huge lack of transparency out there in the provider world, okay? We can cut through all that BS. And when you have the lack of transparency in pricing, you end up getting price gouged a lot of times. We've seen x-rays billed out at $12,000 at certain emergency rooms across the country. $12,000 for an x-ray. How much did that little light flash cost, right? In labor, in electricity, it didn't cost 12 grand. That's a price gouge at its best. And then you have the practice of surprise medical billing, when you might go to the provider, show your little insurance card, maybe pay a little copay, and 30 days down the road, you get this big fat bill in the mail, right? With with an explanation of benefits or whatever, and says, "Hey, you owe me money," right? And it's an amazing percentage of people that literally just pay that. It's a mentality from these providers where we'll throw as much shit up against the wall and see what sticks, right? Because nobody understands medical billing, nobody understands surprise medical billing or being price gouged or the lack of transparency. We can just throw any number on the piece of paper that we want, send it out to the client, and we'll see who pays what, right? The solution to dealing with medical billing is working with MediShield. MediShield Healthcare Advocates. We will make sure you know the cost of your care up front. We will make sure that you're getting the best price for service or the best cost for your visit or procedure. We will go and attack those surprise medical bills, and we will negotiate them down to a fair price, all right? We will do these things for you at MediShield Healthcare Advocates. The next problem in the healthcare industry is the claims process. Submitting claims to the proper insurance company for the benefits. Most people have, especially those of you that buy your own health insurance in the individual market or in the private market, most of you have multiple insurance policies because as expert brokers, we know there's not one health insurance policy that's going to cover you the right way for everything. We literally have to take different policies and piece them together to equal that full package, that full comprehensive package of healthcare for you. So most people will have multiple health insurance policies that equal their package of healthcare. How many people actually know where to submit what bill where, right? Being one of the more thorough agents in the industry, I've actually had clients that have stroked a check for $8,000 to pay a deductible where I would have had a supplement, or I did have a supplement in place to cover that deductible for them, right? Fortunately in that situation, we were able to get that money back, but that client could have been out $8,000 had I not been made aware of the situation, right? So that happens all the time in our industry. Another problem with the claims process is explanation of benefits. EOBs might say something, right? Or they may say one thing where the claim has been paid, it's been discounted, it's been paid, right? But the bill itself is coming from the provider and you're showing full price on the bill. The EOB and the bill from the provider don't match up. The reason is because there's such a lack of communication in the healthcare industry. There's so many different lanes of healthcare. And as customers, you have to travel through multiple lanes of healthcare. You got to see the primary care doctor. You got to go to the lab. You got to go to the surgeon, right? And if all of those bills and all those procedures and all those services from those different providers don't line up with what the insurance company is showing, you could be in a situation where your EOB says one thing and you're getting billed for another thing. That's a problem. Another problem with the claims process in the insurance industry is that AI is starting to manage those claims. Okay? What does that mean? It used to be, right, that we had people looking for any reason to deny claims. Well, the good thing about people looking for reasons to deny claims is even if they denied that claim and you fought it, most of the time you're dealing with a person with a heart. AI has no heart. So AI is now denying claims for insurance companies. Okay? There's still going to be people on the back end working when they have advocacy groups like MediShield contacting them to fight those bills and say, hey, your machine denied this claim wrong, right? But that's something that we're seeing more and more in our industry. And I'm telling you right now, it is a problem now. It's only going to become a bigger problem for the customers, not for the insurers. They're going to be happy to deny claims. They always have been. The customers are going to be the ones that need the help to get those claims paid. Another problem in the insurance industry and the healthcare industry, a pain point, a massive pain point, is prescription drugs, right? What's the problem with prescription drugs? Well, a lot of time on a plan, the deductible may be $7,000, $8,000. You got to meet that deductible before you get any prescription coverage. You may have your own separate deductible for prescriptions specifically, and that happens regularly with plans on the marketplace. How many times does a prescription get prescribed to somebody where a generic form doesn't exist, and you're left buying nothing but the brand name option? And because there's no generic form, that brand name option is thousands of dollars a month, right? The solution for that is working with MediShield Healthcare Advocates, where we work specifically with prescription drug companies that can find you the best costs on those brand name prescriptions. We also work with various vendors of prescription drugs that have access to these drugs from overseas. These are the exact same drugs that we pay 1,000% more in our country for than what they pay in Hungary or in Turkey. So we can get those drugs from those different countries as well. But the solution at the end of the day is working with a healthcare advocate, working with somebody that is an expert on the healthcare industry, can help you navigate the healthcare industry and make sure that you don't become a victim of the healthcare system, but in the process teaching you to be a consumer of your healthcare.